Picture this. You are the parent of a sick child in Stone County, Arkansas, a rural town with no pediatric provider within the county. You call the primary care providers within the city limits and nobody can get him in today. The closest peds clinic is 50 minutes away and you can't make it there. Full practice authority for nurse practitioners throughout the state of Arkansas can break these barriers to care. Good afternoon, Senator Irvin. I am Madison Stewart. I currently hold my Bachelor of Science in Nursing, and I'm in the process of obtaining my Doctorate of Nursing Practice degree from UAMS. We are both currently in a special place and role to advocate for full practice authority for nurse practitioners in Arkansas. According to the American Association of Nurse Practitioners, full practice authority is the authorization of nurse practitioners to evaluate patients, diagnose, order, and interpret lab results, and initiate and manage treatments, including prescribing medications, under the exclusive licensure authority of each state's Board of Nursing. Each nurse practitioner has spent at least 4 years of undergraduate education obtaining a Bachelor of Science in Nursing degree, becoming licensed as a registered nurse, working as an RN for at least 2 years, and then completing a master's or doctoral educational institution, passing national board certification, and then becoming licensed in their own state. The U.S. has nurse practitioners divided into full, reduced, and restrictive practice states. Arkansas is behind the nation, as 25 states are currently full practice. Arkansas currently has reduced practice for nurse practitioners. With reduced practice, the nurse practitioner has the ability to engage in at least one element of practice, but is regulated through a collaborative practice agreement. In March 2021, the Arkansas Senate voted in favor of House Bill 1258. This granted full independent practice to nurse practitioners after completing over 6,000 hours working as a nurse practitioner under a collaborative practice agreement. This is not the same as if Arkansas was to grant nurse practitioners full practice authority. Barriers to full practice include strict payer policies that have regulated funding, billing, and reimbursement. APRN services are only paid 80% of the lesser of the actual charge, or 85% the amount a physician would receive. Even though there's an obvious diversity against payout, APRNs are even then willing to provide the services they need. One misconception about nurse practitioners is that NPs are trying to broaden their scope of practice. We are only trying to work to the full extent of our license. This decreases the types and amounts of healthcare services that can be provided for people who need care. The Institute of Medicine stated, overly restrictive nurse practitioner regulation in some states is the most serious barrier to accessible. Stone County has a patient-to-provider ratio of over 2,000 patients to 1 PCP. This is greater than several surrounding counties of similar population. In Stone County, there is not a single pediatric provider, creating an even larger health disparity for the children of Stone County. This is the impact that reduced practice has on patients and residents of Arkansas. Nurse practitioner participation in primary care is the greatest in states that allow both full practice authority and 100% Medicaid reimbursement. I'm asking that you join me with advocating with and for nurse practitioners within the state to gain full practice authority and 100% Medicaid reimbursement. Change. The critical aspect for patients to receive the health care they desperately need and deserve. Expanded fee-for-service Medicaid to include direct payment for services provided by all nurse practitioners, recognizing nurse practitioners as primary care providers, and requiring Medicaid managed care panels to include nurse practitioners. Collaborative agreements, requirements, and low Medicaid reimbursement rates appear to be barriers to states increasing the distribution of nurse practitioners into the needed settings. In order to fully utilize the nurse practitioner workforce to contribute to improving access to care, changes to states' policies are definitely required. DNP nurse leaders have the opportunity to partner with policy leaders such as yourself, and this has the potential to be advantageous for you and your District 18, which includes several rural counties that have decreased healthcare providers, high rates of preventable diseases, and a high rate of nursing staff constituents. New York State was recently the 25th state in the U.S. to sign nurse practitioners into full practice. By New York, one of the country's most populated states, to fully recognize and allow nurse practitioners to practice at their full level of ability, one can hope that other states will quickly follow suit. In 2019, Arkansas attempted to pass full practice authority. Opponents of the bill stated that the care nurse practitioners prescribe and provide is not as good as that when practicing under physicians. However, when comparing 11 patient outcomes when treated by physicians versus nurse practitioners were comparable or better for all 11 outcomes. In Texas, one of the country's most restrictive practice states, a bill for full practice failed in 2015 due to pressure from members of the Texas Medical Board. It is time to change the focus from nurse practitioners against medical doctors and physicians to providing patients in the communities we serve with greater access to quality and competent health care. Full practice authority will benefit overall patient health care and outcomes. States that restrict or reduce nurse practitioners' ability to practice by limiting licensure authority are more closely associated with geographic healthcare disparities, higher chronic disease burden, primary care shortages, higher cost of care, and lower standings in national health rankings. Benefits of full practice authority will benefit the overall health of Arkansans. This includes improved access to care. Now the sick child from the first slide would have that specialized pediatric care closer to home. Improved patient to provider ratios, especially in the rural areas within the state. Removal of delays in healthcare, and increased professional and personal satisfaction. Cost would be overall decreased if Arkansas became a full practice authority state. Increased access to primary care is associated with lower health care costs, decreased hospitalizations, emergency room visits, and preventative health care. Full practice authority also decreased public health care costs, avoids duplication of healthcare services, and unneeded replication of duplicate orders. Here are my references, including scholarly research guidelines, peer-reviewed resources, and the American Association of Nurse Practitioners position statement. I hope you agree with me that the benefit of full practice authority throughout the state of Arkansas greatly outweighs the detrimental cost to patient health care if not passed.